And today we're getting to know Dr. Dinesh Nair, who's been on the show before.
That's right.
Yeah. Welcome back, Doc. And you're a cardiologist at Mount Elizabeth Hospital. So what's your day-to-day like?
First of all, good morning. Thank you for having me here. It is nice to be here in the morning when I don't have to go in and do my day-to-day work for the first couple of hours of work anyway.
Yeah.
On an average day, I'd go into my clinic. I'd see patients, a wide variety of patients. Patients with heart diseases, patients who are afraid they might have heart diseases, patients who come in with risk factors for it that need to be modified. And then we try and sort these things out for them.
Oh, it sounds depressing, is it?
Actually, no, because what we do is we give people hope.
Yeah.
That's true. That's another way of
they're
looking at
fixing
it.
the problems. That's
We
not
fix it.
depressing.
We fix it at its root cause if we can.
Yeah.
And if they have a problem subsequently, we then fix it for them in another way. So if someone's got a blockage as a result of the heart problems that they have, what I do, and I'm the kind of guy who goes in and does angioplasty or stenting.
okay.
We've talked about that before on the show.
That's right.
Where you put a little wire in, put a balloon, open up the artery,
Yeah.
and restore blood flow.
Hey, Doc, I've always had a question. I watch Grey's Anatomy. And they always play music when they're doing surgery.
Oh,
right?
yeah.
Do you do that? I mean, do doctors here in Singapore do that?
Okay,
during surgery?
some people do. The problem is some of them find it distracting. And if you have a team of people working on a patient, and if someone doesn't really like the heavy metal blaring in the background, you might find that it might throw you off.
But
So,
don't you call the shots? You're the hit honcho, right?
yeah, we do. But
Yeah.
sometimes you work in a team. If you do complex cases and you got a few other people coming in, we're
Yeah.
doing complex valve-related
Yeah.
issues.
Yeah.
So we don't always do that. So
Yeah,
we try to think about other people
Okay.
first.
Okay,
That's
but
what
what
we're
would,
supposed to do.
what would be your choice of music if you ever got to choose and you don't have to worry about all these other things?
I'd go for a little bit rock music from the 70s, 80s, 90s.
Very cool, very
That kind of stuff.
Come on.
I'm not going to name the actual songs right now because
come on,
some
okay.
people,
Kansas.
Def Leppard, you know,
Def
that kind of
Leppard,
stuff.
Wings.
Right.
Yeah, there you go.
Well, the coolest cardiologists around, yeah?
Yeah.
All
It makes
I'm-
me feel better knowing that my cardiologist is listening to Def Leppard. I feel reassured.
No, actually,
And-
Iron Maiden too. So there you go.
Oh my goodness, great. That's Dr. Dinesh Nair, cardiologist from Mount Elizabeth Hospital. And next week, if you have any heart concerns, just send us your questions via our website at kiss92.sg and we'll get Dr. Nair to answer them. Dr. Dinesh Nair, cardiologist from Mount Elizabeth Hospital.
Yeah.
Welcome back, Doc.
Thank you.
Dr. Nair, question here for you. Is there a link between high blood pressure and heart attacks? I mean, different areas of specialty, aren't they, in the first place?
Well, they're all kind of interconnected.
Yep.
So you've got a whole list of things that lead to heart disease. They're called risk factors. High blood pressure, diabetes, high cholesterol, they all play a part. And it isn't kind of a 1 + 1 = 2 relationship. If you get a 1 + 1, sometimes you get a 3. Because all these things work together and they increase each other's risk for heart disease. How does high blood pressure affect your heart? First of all, it increases the pressure in the walls. There's a lot of causes for high blood pressure. We can go into that another time. But with that extra force on the wall, what you get is trauma, damage to the vessel walls and to the heart muscle itself. If you've got damage to the heart muscle, what you get is like as if the heart's doing weights.
Right.
So it's resisting this pressure, it's getting thicker and thicker,
Right.
it's getting muscle bound. And at some point, just like you're doing weights, you hit failure and the heart fails and it fails to be able to pump.
Oh, no.
But with the vessels as well, what you get is big shear forces, scar tissue occurring in the insides of the vessels. And this scar tissue it's like the inside of a pipe in an old house. If it's smooth and clean, it's fine, the blood flows. If it's not, what you get is stuff sticking to it. All that gunk that sticks to it is usually cholesterol and other stuff.
Right.
And so if your cholesterol's high, the more gunk you have, the more that sticks to it, the more blockages that you get. And eventually these blockages get bigger and bigger and bigger and block off the artery. And you can get a heart attack as a result. But the blood pressure doesn't increase your cholesterol per se.
Right.
But it's a risk factor that works in conjunction with the cholesterol to increase
Okay.
your risk.
How can someone manage their high blood pressure?
A lot of people think it's actually a misconception. Most people think that if you've got high blood pressure, you have symptoms. You actually don't in the beginning.
Right.
Most people don't. Your pressure's high because you measure it with a doctor in the clinic. It's high. You have these small tears in your arteries, and if you don't detect it early enough, you have a problem.
Right.
But when you do detect it early, you can reduce your salt intake, lose weight. Losing 10 kilos, 10 pounds can drop your blood pressure 10, 20 points on the scale.
So weight is a huge factor in your blood pressure.
Weight is a big factor.
Is that because your heart just has to pump harder to get all the blood through your big body?
That's actually very true.
Is that right?
It is true.
Wow.
Nice guess. That's one of the reasons. That's an oversimplification. though.
Right. That's kind of the idea.
It's easier that way, yes.
Right, right.
But most people will end up having to take medication.
Right.
And that medication reduces your risk manyfold. Reduces the risk of heart failure, heart
Okay.
attack, stroke 50%.
That's
I'm
amazing.
curious, do you treat both at the same time? Do you treat the high blood pressure and the heart as a doctor?
Yes.
Yeah, both
yes.
of them.
So
Okay.
within our practice, we actually treat all the risk factors
Right.
leading up to it as well,
Okay.
and also what happens as a result of getting heart problems.
Wow.
So we treat them both.
That's
And
incredible.
often the medication's the same. So we've got medicines. We live in a great age. We've got medications nowadays that can address 3 different problems at the same time.
Oh, okay,
Yes.
cool.
Thank you, Dr. Naya. And that was Dr. Dinesh Naya, cardiologist from Mount Elizabeth Hospital. And every Thursday, we speak to a doctor here in Doctors in the House. If
Thank
you have
you.
any questions, you can always send them in via our website at kiss92.sg for our doctors. Thank you.